Namaste. How are all of you, and welcome to the live where we are going to be talking to Dr. Gursimran Kocchar about everything that affects our gut. Why is it that we have smelly farts? Why do we have blood in our stools? Why do we have a change in motion? Why am I having diarrhea? Why do I all of a sudden seem to lose weight? What kind of therapy do I actually need? Do I need to make changes to my diet? Is it being caused because of lack of sleep? Where exactly am I going wrong? And what is IBS and how is it different from ulcerative colitis? And what is IBD? And what really then is Crohn's? So for all this and much more, we have Dr. Gursimran Kocchar, who is joining us all the way from USA. He's currently in Pittsburgh, Pennsylvania. He specializes in interventional inflammatory bowel disease and advanced therapeutic procedures. He's really very acclaimed, and you can read a lot about him anywhere on the net. So you could just Google him. You can also follow him on Twitter, and currently we have also gotten him to sign in onto Instagram, but I'm going to now request him to join us, and just hold on for a second till he actually comes online. So I'm going to be doing that shortly. What's his handle? Just 1 second. So we are going to be I'm going to be asking him a few questions, and then we are also going to be doing questions from the audience. Hi, good evening. कैसे हो आप?
Good evening. बहुत बढ़िया.
Thank you for joining us. We are all very excited. As you can see, we are at least 1,500 people from across the globe wanting to learn about things from you. Okay, but
It's an honor to be with you. Yes, thank you so much.
Thanks. But before I ask you any questions, I want to tell you that you look great in the red pagdi. It's looking superb, and matching with the red tie.
Thank you.
Okay, so before I ask you anything, I mean, my first question for you is that we've been doing a few videos on IBS, and talking about how one could manage symptoms at home through simple interventions of food and exercise and sleep. But is IBS the same thing as IBD? Or can I get IBS and then it develop into IBD? Like, what's really the difference, and why are we seeing people with more issues with their digestion currently than maybe what we saw them 10 years ago?
Yes, no, that's an excellent question. Thank you so much for that. That is one question that the IBD specialist, always like to answer and clear. So, first of all, IBD and IBS are completely separate entities. IBD, what we know as inflammatory bowel disease, Crohn's disease, ulcerative colitis are the common names. These are autoimmune diseases, meaning your body's defense system is acting against its own body. So these can be very morbid conditions with a lot of, complex problems, complications down the road, to the extent people requiring surgeries, losing part of their intestines, and many horrible things. And if not treated, they are very progressive. So those are diseases we do not need to have, if given a choice. On the other hand, IBS, or more commonly is called as irritable bowel syndrome, it's a functional GI disease. This disease is very distressing to the patient, but there is a good thing about this, that this is not going to cause them to shorten their lifespan. If they are destined by God to live 85 years and they have IBS, more so or likely IBS will not be the cause of the problem. But it's a very distressing issue for the patients, meaning if you have belly pain all day long, you give your 100% best to anything else you are doing, be it your work, be it your family, be it your... So it's a in that regards very distressing for the patients. But unlike IBD can be sometimes, life-threatening also in the old age. Now we have medications that we can, have very good control. But luckily, IBS in that regards is very different. So their pathophysiology is different. So that's a very important distinction to have. Can IBS ever cause IBD? We never say never in medicine, but it's not possible that IBS can cause IBD. If you are prone to develop IBD, you can develop IBD at any age. Meaning, if you have constipation issues or belly pain issues since your birth, but now at age 40, 45, you got diagnosed with Crohn's disease or ulcerative colitis, that probably is a slightly separate issue. Patients with IBD, Crohn's disease, and ulcerative colitis, they have IBS. We now find this mutual overlap distinction all the time. We have patients in whom we have controlled the inflammation, we have controlled their disease, but they still have complaints of bloating and belly pain and diarrhea. So they have IBS on top of IBD. So yes, they can coexist together, but IBS usually does not lead to IBD.
Okay.
Yeah.
How would I know that I have IBD? Would I need a test? Are there any symptoms that I need to look out for? Should I avoid a doctor as far as I can? What is it that I should be doing? What should I watch out for?
So a golden rule of thumb, and even when I was in India in my med school, I used to tell this to all my patients. If there is a problem that is persisting more than 4 to 6 weeks,
okay,
not even gut, even if you have a headache more than 4 to 6 weeks, you should seek medical attention, because you can't have a viral illness, ya garam sard, ya thand garmi lagi, for 6 weeks.
Yeah.
Right. It should not be persisting for long. So for IBD treatment or for the IBD diagnosis, you need to see a specialist gastroenterologist. They have to take a good history and do a good physical exam. And then they will do some testing, which may include imaging, like a CT scan or an MRI, along with an endoscopy and a colonoscopy, because they'll have to get biopsies. Because especially in India, it's a little difficult to diagnose IBD. And I've been working with a couple of Indian societies now to bring more awareness about this disease, because in India you have other diseases like tuberculosis that can mimic IBD. Like tuberculosis can mimic Crohn's disease. So it can sometimes become very challenging to differentiate between intestinal TB and Crohn's disease. We have some gastroenterologists who were just dedicated their life in India to this part of the problem, how to fizzle that out. So any symptoms you have which are lasting more than 4-6 weeks, even if you think they might be mild, like chalo thoda sa diarrhea, thodi si belly pain hai, if they're lasting for 6 weeks or so, you should go, because then your doctor can do some blood work, do the history physical, do these CAT scans if need be, and the procedures, and then get you on track, because symptoms can mimic.
Right.
Yeah.
And when you mean get you on track, what really is the track that one is looking at?
Yes. So for IBD, I mean, if it's for IBD, we have now medications available. Most of them are available in India also. These are the medications, because remember, IBD is a disease in which your body's immune system is kind of, acting against your own body. So we give these medications to kind of help that immune system not do that and control the inflammation. Once we control the inflammation, we can prevent downstream complications. The disease never goes away, but we can keep it in check that you live a normal quality of life. For IBS, there are a lot of things you can do before you go on medical therapy, and that depends on how severe your symptoms are. So because IBS, as I said, is a more of a functional gut disease, versus IBD. So IBD requires a little bit more proactive attention, getting on the board quickly with medications and things like that. And with IBS, you definitely try to see what is the trigger. And if you can eliminate that trigger with diet or exercise or, better relaxation techniques. And if they don't work and you still keep moving, then there are other medications that can be started based on your symptoms.
All right. So, in your opinion, would you say that digestion is almost central to one's life, and that if your digestion is messed up, then, you know, then like you were saying, everything else in your life is a little suboptimal, you're a little less focused. What role does digestion play in our well-being?
A huge role, not just well-being health-wise, but even outside the gut health. So we now realize that the immune system and everything, starts in the GI tract. There is a very strong correlation of our central nervous system with our GI tract, and that is something that starts, when the fetus is there, the interaction. So anything that we do, has an effect on our gut. And I'm sure your audience can appreciate there have been times when, a teacher in the school yells at you in front of the entire class, and first thing you have is a hunch in the belly, because you're releasing your stress, or before the exam, we get diarrhea and belly pain.
Yes.
That's all the stress being going on your GI tract. So there
Yes.
is a strong correlation. And if your digestion is not healthy, you can't enjoy the foods you eat. If you're not digesting the foods well, because food also has a comfort level for us. uh, I'm a foodie, so I love eating. So for us, it has some comfort level also. And if you're not digesting that well, or you're having issues every time you eat, that can be very distressing, as I said. Because imagine you pay so much money and you, let's say, go for a foreign vacation, and you can't enjoy there because now your belly is not behaving well and you are just stuck in a room. So it has a lot of consequences just beyond your gut.
Right, right.
Yeah.
You know, in my line of work, I've seen that one of the conditions that really gets to family members, or caregivers, which stresses out people within the families, also if anyone has IBD, because, then either their spouse or partner or parent, child is always on the back foot, because like you said, you're first looking at what kind of foods are available, and then you are going out there. Do you think there are strategies that people could use to kind of increase the variety of foods that they could eat and lead a normal or an optimum life, even if they had IBD?
Yes. So, for IBD, the management is so for IBD, it's a chronic disease. So we have to treat it. And in India, IBD in last decade has grown exponentially. We know that it was traditionally a disease of the West. It was not there. Like if you look back literature 70, 80 years ago, we probably didn't have that much IBD in India. So now it is increasing. And as I mentioned, there are a couple of, large societies that are working exclusively for IBD patients in India. I happen to be involved with them, so I know they're doing some really good work. So, in regards to management of IBD, you have to have all components. You have to have your medical therapy. You have to have your surgeons available if need be, because in IBD, sometimes surgery is not the last resort based on what complications you have or how you're presenting. Nutrition makes a very important component, because now we realize that patients who are not nutritionally well, who have malnutrition, they will not have that good response to therapies, both medical or surgical. And then there are obviously some triggers. As I said, IBS can coexist with IBD. For example, if you have IBD and you're lactose intolerant, then you should be avoiding, milk with lactose. You should take lactate-free milk. That's a very easy trigger. So things like that. And then the last component in IBD management, which I think in India is a little bit overlooked, just a part of our culture, is the psychosocial component. So it's not just a disease affecting one family member. You need support of your family, your friends, everyone to understand what you have, because it can be emotionally challenging. Because sometimes patients with IBD have a lot of urgency type symptoms. So imagine you're in a shopping mall and you just have to run to the bathroom, right? Now, even when I was in school and college in India, we'll joke about this, like, oh, he's in the bathroom. So, but it's not a matter of joke. It is their disease pushing them to the limit. So I think all these four components of medical, surgery, nutrition, psychosocial have to be invested in the care of an IBD patient. In the IBS side of the world, you have nutrition playing a very central role. More major role is played by nutrition in those patients to see how we can, modulate the GI tract and their symptoms better. One additional thing in IBD side, which I failed to mention, was in nutrition regard specifically. There is a lot of stress on how to have certain foods that reduce inflammation in your body. And IBD is an inflammation condition. So there is a lot of research going on. We don't have one specific diet, as we say, so that will help IBD patients. But in general, and this is what my practice is, anything that will promote the gut bacteria health, which basically means the fiber foods, rich fiber foods, and any pre and probiotic foods, for example, dahi, lassi, these are great to include rather than having those prebiotic or probiotic capsules, because these are the traditional ways of putting good gut bacteria. So all those factors will help IBD patients to regulate their gut better. Yes.
Yeah. No, thank you. That's very informative, because otherwise, one is just buying expensive pre and probiotic drinks from the internet and hoping for some miracle, but like not really doing the very basics with food. And like you said, that if we are not nutritionally well equipped, we can't hope for, whether it's the medical therapy, whether it's a procedure that one goes through, or whether it's drugs that one is on to really have optimum outcomes. So we will still need to do our basics right, correct?
Yes, absolutely. It goes without saying. I think medications and surgery, everything helps so much. The factors which are in control are good nutrition, good sleep, because sleep is very important.
Correct.
And how to relax your mind and body. So I think these three things are in our control. And the advice that you give is the advice what I give to my patients. Don't eat any food that your grandparents won't eat. So I think that's the golden.
Oh, that's good. Now, what role does stress play, not just in IBD, but in anything related to digestion? What role does stress play even for something as simple as acidity? Because just so many of us seem to be having acidity or gas or bloating or smelly farts, constipation. Is stress a factor?
Huge factor. Stress is a huge factor. As I mentioned, take a classic example of a 10, 11-year-old child who has an exam in the next day in the school. A night before the exam, they have diarrhea or belly pain or something else.
Right.
And when the exam is done, they are out in the street playing cricket. And he was making an excuse. But no, he or she was not making an excuse. It is just a child doesn't know how to release the stress externally. They release on the gut. So when you have stress in the body constantly, you release various different hormones. I mean, and we can go in great detail about that once they are released in your body, they modulate various things, even from factors like weight gain. Some people find very hard to lose weight, but if you look at, they're constantly very stressed. Acidity, people have more acid reflux symptoms if they're type A personalities. We know that, very high stressful jobs. So stress overall, not just GI tract, but overall, from your sleeping patterns to your body weights to your how you're going to metabolize your food, it plays a huge role. So, and our lives are becoming very stressful, in general, not just everybody's home situation, but externally also factors are there that keep our stress level high. So in during these times, it is very, very important to find something that kind of de-stresses you. So for my patients, I always ask them here, I said, is there one activity in a day that can take you 30 minutes away from the world? Be it swimming, be it playing guitar, be it running, be it doing yoga, be it anything that you can switch your phone off and deconnect yourself from the world for 30 minutes. I think that everyone should of us have in a day's time. It's very important.
Do you see any kind of a subgroup? Like, do you find that digestive disorders are more common in men versus women, or in your line of work, maybe more immigrants than, or more newcomers or younger people? Is there any kind of a trend that you're seeing currently?
So we have good data in this regard. So all the autoimmune diseases usually are higher in females. So by default, even IBD, that's an autoimmune disease, is more female preponderant. Same thing with irritable bowel syndrome, IBS as well. IBS also is higher in females compared to men. So there is that gender difference for sure. And again, both IBD and IBS traditionally were disease of the West. So obviously, the Western population is higher, in preponderance towards this disease. However, India and Asia in general is now catching up. Our rates of IBD and autoimmune diseases are skyrocketing, as I mentioned, in those countries. And there are various theories, there are various hypotheses, but obviously somewhere the change in diet and change in lifestyle has also played a role. But there are a lot of hypotheses that will be too much detail to discuss here. But diet definitely and the change in lifestyle played a great role. But both these diseases, as I mentioned, we see more in females as compared to men.
Okay. A lot of women that I know who would probably see their doctor with initial complaints, like the way you were saying, if it's like just 4 to 6 weeks of, any kind of diarrhea or belly pain or constipation and stuff. And a lot of them get prescribed maybe a sleeping pill or an antidepressant. So is that, and they take that and it doesn't seem to take their symptoms away, but should that be the first line of treatment, or are we looking at something else? Like, what is it that one should be even looking for? Like, even right now here there's a comment saying, oh, I'm on PPIs for the last 10 years. So is that all that one can that one is looking for, even in terms of medication, an antidepressant, a sleeping pill, PPI?
Right. So I think in IBS, you have cluster of complaints that can happen. You can have true reflux disease, what we call as GERD, or you can have a disease called functional dyspepsia, in which your body is feeling exactly the same symptoms as GERD, but you don't have higher acid production.
Okay.
It is basically the nerves in your esophagus tell your brain that I'm feeling acid, but when we do the acid test, it is not there. So for those patients, being on PPI will be not helpful because the trigger is not there. The other symptoms in IBS patients, like abdominal pain, constipation, diarrhea, I think based on what symptoms you have, number one, and number two, how severe your symptoms are.
Correct.
So when I see patients in the clinic, my goal is, if someone has mild to moderate symptom and they are aware patients, when I mean aware patients, mean they understand what they're eating, what they're doing, and they're very involved in their care, I usually start with non-pharma therapies. I don't go straight to medications. But if your symptoms are very severe, again, because severe symptoms will cause poor quality of life. And if you truly have, for example, reflux disease, your question about PPI, in my practice, if someone truly has reflux disease, then PPI is helpful, because chronic reflux is a risk factor for esophageal cancer. You don't want that. But I think one has to make this distinction, that is it true reflux, or am I treating functional dyspepsia and things of that nature. So severity of your symptoms in my practice decide, should we go on non-pharma therapy.